Welcome to Sheriff on Vibe, the place for travel tips, news, deals, entertainment, and fun. We know there's a lot of concern going on in the world about the coronavirus, and being Jamaica's only cruise specialist, we are on top of the breaking news. And there are three different bits of presentations that we want to share with you today. The first one comes from the Ministry of Health and Wellness, and this press release dated March 4th is one worthy of being read verbatim. It says the Ministry of Health dispels rumors of coronavirus in Jamaica. Now, from Kingston, Jamaica, the head office, this release states the Ministry of Health and Wellness is advising the public that there are currently no confirmed cases of the new coronavirus, the COVID-19, in Jamaica. There are no cases of coronavirus on the island at this time. Further, should the virus reach our shores, the ministry will immediately notify the public, said the Chief Medical Officer, CMO, Dr. Jacqueline Bissor McKenzie. The CMO's statement comes amidst rumors that the virus has been detected in Jamaica. We understand the public concern, the release further says, and the fear associated with this virus given the scope of the public health threat globally. However, the spread of incorrect information about the virus is decisively unhelpful to our response efforts, noted the Ministry of Health and Wellness Minister Dr. Christopher Tufton. So please be guided. And I got word from Kingston, Ontario, just this morning that news has circulated there stating that Jamaica has at least confirmed cases. Just want to dispel that. That's a myth. There's no truth in it. There is no confirmed case of the coronavirus in Jamaica. We are moving about, living, having fun, doing what Jamaicans do on a daily basis, and we are being guided by the reports from the Ministry of Health and Wellness. And personally, I am aware that every effort has been taken to preserve the well-being of those within our shores. So, for those who are concerned, please let us help each other dispel this breaking bad news. There is no truth. There is no evidence of coronavirus in Jamaica.
We will provide the country with some of that information after Thursday.
Well, let's go right there because that's one of the concerns. What if the virus should hit Jamaica? Are there adequate supplies, for example, of reagents for testing? Are there adequate supplies of masks and other protective gear?
Right. So in medical science and in the planning for an event, we use historical data and make certain projections and under the general ambit of epidemiology. And we have done some modeling as to what could be the possible scenarios in terms of number of persons affected based on the history of the virus. And we've been looking at the history, short history, but nevertheless, in other countries. So we have an idea, or at least a sense of how we think the virus will, if it were to come here, would have impact us, and therefore what we would need in terms of hospital beds, isolation areas, quarantine facilities, and so on. So that plan would seek to look at how we would approach that, who are the critical agencies that would be involved in that process. I mean, the Army, suppliers, because sometimes you may have to restrict movement, restrict congregation of persons. Certain events may have to be postponed or cancelled.
You're hinting at an election postponement?
And then, no, not at all. And then, of course, on the clinical side, it may require, or it would require, entire wards of hospitals to be dedicated to isolation facilities for that particular purpose. Maybe even a hospital that would have to be vacated and preserved just for that purpose.
Now, the next reports we will get will be updates from the Princess Cruises Chief Medical Officer, as well as from Richard Fain from Royal Caribbean Cruise Lines.
Hello. Today we wanted to share some thoughts with you from all of your friends here at the Royal Caribbean Group. This is a tough time, a really tough time, and all of us know it because all of us are going through it together. And after enough challenging days for your business, after reading enough of the endless media reports about coronavirus, it's really easy to think that the world is coming to an end. Well, I have a spoiler alert. It's not. We're all spending time worrying, and that's natural because we're in a storm, and when you're in the middle of a storm, it certainly feels like it'll never end. But as with most storms, it gets worse before it gets better. But it's hard to remember that this too shall pass. And while the virus is something to be taken seriously, it's not a cause for panic, not in a personal sense, and not in a business sense either. As far as the business impact on our business, it ain't pretty. In fact, to use a technical term I learned in business school, it sucks. Like you, we're hurting. We've had to cancel cruises, we've lost revenue, and our people are putting in long days looking out for the health and safety of our guests and our crew. But we've absolutely sailed through rough waters like this before, and we've weathered every storm side by side with you.
While traveling and getting ready for your trip, there are simple everyday tips you should follow to help reduce the risk of illness, keep you safe, and be prepared. First, when getting ready to travel, it's extremely important that if you've been sick or start to feel unwell, especially if you develop a fever, cough, or have difficulty breathing, we ask you to please stay home to completely recover. The consequences of traveling when ill not only affect you, but also all those around you. For all travelers, be careful to avoid close contact with those who may be ill as well. As with all cruises, we strongly recommend you consult with your healthcare provider prior to travel to get health advice particularly tailored for your personal needs. You should also bring copies of your medical records with you, including any EKGs if you have heart disease. If you take prescription medication, it's a good idea to bring enough medication for at least 2 weeks beyond the length of your trip, just in case you get delayed. And carry the medication in your hand luggage. Know the exact medication names and your specific dosage. If you have a smartphone, take a picture of the label and of each medication. And especially during cold and flu season, you may also want to bring your own thermometer to monitor your own health and temperature. Another important travel recommendation is for you to buy travel insurance. Make sure it's the kind that is cancelled for any reason and covers many unexpected travel situations, such as medical care and evacuation.